Fun fact, in the 19th century, hay fever was actually known as a disease of upper class or so-called rose cold. So some antihistamines have been moved to POM, which means prescription-only medication, because of the increase in antihistamine-related deaths. Men who nearly died from peanut allergy now eats them for breakfast. The number of allergies, just the prevalence of allergies, has increased over the years. Hey there! Welcome back to Nadia's Lab. Thank you for tuning in. I'm Nadia, I'm your host, and I'm your partner in decoding science behind everyday health. As you might already know, I'm a clinical pharmacist working in research, and I like to host this podcast to talk about things that I'm passionate about, such as healthcare, wellness, well-being, and research. Are your eyes watery? Is your nose itchy? Are your eyes itchy? Are you dreading that walk in the park? You're not alone. It's you and me, my friend. I never had allergies or hay fever in my life, but this spring, it seems like it's gotten to me. So yes, you're right. Today, we're going to be talking about different kind of allergies, from medication allergies to food allergies to pollen allergies, which is hay fever. I'll give you some tips and advice on how to treat them, some background of why they occur, what symptoms are, and what are some medications which are available out there, as well as some natural medicine options and some lifestyle tips and advice how to treat them. We'll also discuss some research which is currently helping treat severe peanut allergies. So yeah, if this is something that interests you, or if you are struggling with hay fever or allergies, do tune in, grab a cup of tea unless you're allergic to it, and let's uncover it all. Okay, so what is an allergy? So an allergy is basically your immune system overreacting to something that's not actually harmful. So your immune system sees peanuts or pollen, in case you're allergic to pollen or peanuts, as a foreign body, as something dangerous, which it then need to attack. So your body essentially goes in a full-on defense mode, which leads to the release of this substance called histamine. Histamine is released from mast cells and basophils, and then it binds to histamine H1 receptors, leading to inflammations and affecting our eyes, our nose, our respirators, our breathing, our airways. And this is essentially what's caused the annoying symptoms of hay fever. So why do some people get allergies? So genetics plays a very important role. So if your parents have allergies, you are likely to have them as well. What also matters is the environment too. We say there is a hygiene hypothesis. That means if you grow up in a super clean environment, not as exposed to any dirt, you're then in adulthood more likely to develop allergies and be sensitive to harmless substances. Also, there are things such as asthma, eczema, and hay fever. They often travel in trio, which is what we call atopic triad. So if you have one of them, you're likely to have the other. People who have hay fever, which is also called allergic rhinitis, their immune system is overreacting to a harmless substance. And if in case of hay fever, that substance is pollen. Now, there are different kinds of pollen allergies. So that can be wheat, grass, or tree allergy. And we'll get to that soon. So the symptoms that occur, like I said, because histamine binds to its receptor, and then it causes sneezing, runny or blocked nose, itchy, watery eyes, itchy throat or ear, and it can also cause wheezing and bronchospasm. So that's why you find it kind of difficult to breathe. And it can also cause fatigue. So hay fever can actually make you tired. Now, when we talk about hay fevers, aka allergic rhinitis, you will notice that not everyone experiences the symptoms at the same time of the year, at the same season. So hay fever is allergy to pollen. That can then be further divided to different types of pollen. So if you're allergic to tree pollen, you're most likely to be affected between February and May. And mostly you're reacting to like birch, oak, and mostly male trees. We'll get back to this point. If you are allergic to grass pollen, you're mostly going to be affected between period of May to July. So pretty much in the summertime. And this is actually most common type of pollen allergy in the UK. And this is what's causing most trouble in most of people. There's also wheat pollen allergy, and this is more common in the US. And it's usually the symptoms are worse between June and September. Now, you might have heard of this one before, but one of the reasons the hay fever are so bad and common in cities like London is because of this, what we call botanical sexism. Yes, that's true. So large cities like London have planted mostly male trees. They look, they're big, they're greeny, leafy, they look beautiful. And the reason they've planted more male trees than female trees is because male trees do not produce seeds and fruit. Hence, there's less mess that needs to be cleaned up. But male trees produce much more pollen. So essentially, by planting so many male trees, they've created this, I don't want to say evil trees, but trees that produce so much pollen, and there's not enough female trees that can absorb this pollen, hence the excess pollen, which is causing hay fever in a lot of people, including myself. So whether this entirely, we can't really say that, botanical sexism in the male trees is the main reason why we have hay fever. There are other reasons why hay fever occur. So I mentioned that genetics is a quite important factor, but there is also factors such as air pollution. So air pollution can bind with pollen and that can make it worse. So cities which are quite polluted, that is not great, obviously. Climate change is an important factor as well, because actually they say that Earth's average temperature has risen by about 1.1 degrees Celsius since pre-industrial times, which means that the pollen seasons are longer. Hence, that is why there's more hay fever and allergies around. Also, lifestyle and, as I mentioned, genetic predisposition, the way we're brought up, what we eat, all of this can play an important factor. So what can we do about hay fever? I mean, unfortunately, we can't do much about botanical sexism, can we? But what can we do on everyday to try to make her life easier and to be less affected by it? Because a number of people that I know that are really, instead of enjoying the beautiful spring and summer weather in the UK, they're really suffering and they're canceling their plans because of hay fever, which I honestly find very sad. So what is it that we can do? And as a pharmacist, I get this question quite often. What shall I take? What shall I do? How can you help me with my hay fever? So essentially, let's look at what happens during the hay fever. So like I mentioned, when you're exposed to an allergen, if you have hay fever, an allergen, let's say pollen, your immune system sees it as, let's go in a defense mode, let's attack this. So mast cells release histamine. The histamine then binds to H1 receptors. It then causes all the symptoms. So the way antihistamines work, and that is your main go-to treatment for hay fever, is essentially they block these receptors and prevent histamine from binding, so from attaching and activating these receptors, and therefore they either prevent or reduce the symptoms of hay fever. And they act on nose, eyes, skin, and airways, exactly where the symptoms happen, which is essentially where these H1 receptors are located. Antihistamines, they will not stop histamines from being released from your mast cells, but they will just prevent the histamine from binding to its receptors, hence causing the symptoms. So bear in mind, antihistamines are not effective in allergic reactions. They cannot treat a severe allergic reaction called anaphylaxis. For that, we need something like adrenaline, an EpiPen. However, they are quite useful for hay fever. So, fun fact, in the 19th century, hay fever was actually known as a disease of upper class, or so-called rose cold. This is because it mostly affected the wealthy, higher class citizens who spend more time in the countryside around flowers and grass. It was even considered a fashionable disease, and some Victorian doctors believed that it was linked to overeducation or sensitive nerves. I find this so crazy. But that's one way to look at it. So the first antihistamine was actually discovered a long time ago by accident in 1930s. Actually, that is before FDA even existed, and FDA is authority which approves medication. Now, the way it was discovered, scientists were looking for a cure for anaphylaxis, the serious allergic reaction, but instead they ended up producing the substances which made lab animals feel sleepy. And that is how first generation antihistamines were discovered. First generation antihistamines are known to be drowsy ones. The reason for this is because they cross the blood-brain barrier, which means they can have central nervous system effects. So they can affect your CNS, central nervous system, and they can actually cause sedation and make you drowsy. One of the first, actually the first antihistamine that was developed, it exists still now under the brain Benadryl, and it is called diphenhydramine, and it is still used for allergies, but also sleep today. So first generation antihistamines, drowsy, sedating ones. So there is chloramphenemine is your first generation. Promethazine is your first generation older antihistamines. And essentially, they are making you drowsy, and they are known for having a lot of other uses, not just for hay fever. They are used for anxiety. They're used for insomnia sometimes, so help with sleep. They can also be used for nausea and vomiting. And they can also be used for some cold symptoms because they can cause the mucus, dry up the mucus when you have a cold. Now, there was an article published in Pharmaceutical Journal, and it said rise in antihistamine related deaths prompts call for moving them to POM status. So some antihistamines have been moved to POM, which means prescription only medication, because of the increase in antihistamine related deaths. So essentially, medications are divided either over the counter, they're available over the counter, anyone can buy them pretty much anywhere, even in supermarket, or there can be medicine, so they are available in a pharmacy only, and you can only buy them in presence of a pharmacist, or POM medication, so prescription only medication. That means they need to be prescribed by your doctor or a prescribing pharmacist. So some first generation antihistamines have been switched to POM. That means that you need to have a consultation with a doctor who then needs to prescribe it on a prescription before obtaining it. And now, why did this happen? So why were there increased deaths, and why was this need to reclassify them to prescription only medication? Well, like I mentioned, first generation antihistamines, because they could cross blood-brain barrier, they had CNS effects, they could cause sedation, they can cause drowsiness. Now imagine if someone takes this and then on top of that they take alcohol or they take opioids, there is a risk of respiratory depression and risk of fatal overdoses increases. Also, misuse and abuse. Some people were abusing first generation antihistamines such as promethazine, taking it in such high doses to get the hallucinogenic effect, which can also be quite dangerous. And finally, there are some studies which show that there can be a cognitive impairment, especially first generation antihistamines are given to elderly patients. It can basically be associated with cognitive decline, such as causing dementia and memory issues if taken in elderly patients. So because of all of this, it was decided that although first generation antihistamines are still used, they're good drugs, there is a lot of risk associated with them. And some of them like chlorphenamine, which is a first generation antihistamine, you can still buy it over the counter, it's quite safe. But some of them like promethazine are now prescription only medication. So you should only be taking it if prescribed by your doctor. So, as you can imagine, because of all of this, there was a need to improve and create new antihistamines that can just be used by pretty much everyone on daily basis, because a lot of people suffer from hay fevers. Hence, the second generation or so-called non-drowsy antihistamines were developed. So what are these? So these are available over the counter and they are cetirizine. So you've probably seen cetirizine. Cetirizine is a second generation antihistamine taken as one tablet once a day. It is also a most commonly purchased over the counter antihistamine in the UK. Then there is also loratadine, there is acrivestin, and few other. I personally think acrivestin or Benadryl, it needs to be taken 3 times a day, which can be a bit annoying, but it is incredibly effective and it acts really fast. If you don't want to take something 3 times a day, then I would say cetirizine would be next option because it's just once daily. If not, loratadine is also a good once daily option. Essentially, sometimes you have to try one antihistamine, it doesn't work, you try another one, you try a third one. So you might need to try more than one in order to find the one that really works for you. Although they're non-sedating antihistamines, they still have some unwanted effects and they can cause some sedation potentially as an unwanted effect. Other thing that you can do, they're nasal sprays. So they're steroid sprays such as beclomethasone or mometasone, and these can reduce inflammation in your nostrils, which can help a bit with breathing and your symptoms. Eye drops are recommended as well in case you have watery or itchy eyes. So sodium chromoglycate is used, and I believe it's called allergy eye drops, and that can stop the itchy, watery eyes. Barrier creams, so using not a cream but a balm, like using Vaseline around your nostril, can also help kind of trap pollen, preventing it from going inside your nostrils. If you've tried all of this over-the-counter products and some lifestyle hacks, which I will be talking about, there are also some prescription-only medications such as desloratadine or fexofenadine, which are also antihistamines that can be prescribed by the doctor and tend to be quite effective as well. Now, there are so many life hacks, lifestyle advice that you can, try and practice prior to taking any medications, and I'll discuss this. But I feel a bit like some of these lifestyle hacks, even the ones that I was giving to the patients or the ones that I was taught in school, I feel like are really, really extreme. For example, checking the pollen forecast and not leaving your home during high pollen hours, I think that can be a bit extreme. So when it comes to lifestyle advice, I want to give something realistic and something that people can actually practice and implement in their daily routines. So shower and change clothes when you come in is advisable. I know it's not always feasible, but maybe, changing clothes could be possible. Keeping the window shut during peak pollen times, such as early morning, I think this is a good one. It's not too difficult to do it. Also, HEPA filters indoors. So these can be quite useful and they can clear kind of the air. Other thing, wearing sunglasses with like an extra shield. And as I mentioned, putting something like a Vaseline around your nostrils, just like a barrier to prevent the pollen from going in. Now, if you don't like taking any medications, or if the medications alone are not helping, there are also some natural ways to ease the hay fever symptoms. And some people think that buying and eating local honey can actually help because it builds tolerance to pollen. Studies have not proven that this is definitely correct, but there's good anecdotal information out there that this might be effective. Nasal irrigation with saline can help because it can clear the pollen from your nostrils. Also, eating a lot of vitamin C, which acts as a natural antihistamine, can help fight the hay fever. Certain natural compounds as well, such as compound called quercetin, found in foods like onions and apples, can also be helpful and beneficial. Finally, there is an option of inhaling peppermint or eucalyptus essential oils just to open up the nasal passages. So these are like natural hacks or medicines, which there's no research to back it up, but it has helped some people and you can trial it out. So I got this question a few weeks ago and someone asked me if hay fever can cause asthma or if hay fever can lead to asthma. So hay fever does not directly cause asthma, but it can significantly worsen the asthma symptoms, and having like a hay fever and, being are surrounded by a lot of pollen can definitely trigger an asthma attack and make your asthma worse. Also, it's quite good to know and distinguish the difference between hay fever and a cold. I feel like the symptoms can be quite similar for the two. So it is really important to distinguish the two. So they can both present with very similar symptoms. So the nose, the sore throat, even a cough sometimes can happen in both. But obviously the main differences are, I mean, first of all, your cold is going to be for a shorter amount of time, whereas hay fever is likely going to be for weeks or months, right? Secondly, we obviously know that the cause in a cold, your body's reacting towards something that's actually harmful. In hay fever, your body is reacting to something that's essentially harmless. Although it's quite difficult to distinguish between the two because the symptoms can be very similar, as I said. But I would say the main difference, if you're trying to distinguish whether you have hay fever or cold in order to know what kind of advice and what kind of treatment you need. So hay fever, you will get watery and itchy eyes. This should not happen during your cold. During your cold, you will have more body pain and you might have a fever. You will never get this with hay fever. So hay fever, you don't get fever and you don't get body pains. You can get a bit of fatigue and be tired, but you shouldn't really be getting body pains. And finally, the mucus. The type of mucus in hay fever is like clear, transparent mucus, whereas if you have a cold, the mucus can be thick, yellow, or green. Now, moving on to allergies, the more severe part. So let's talk about a big one. Let's talk about penicillin allergy, which is quite common and I would say one of the most common medication allergy out there. So the trick here is that actually over 90% of people who think they're allergic to penicillin are not actually allergic to it. So I'll give you some examples. So if a patient says, oh, sorry, I'm allergic to penicillin, I can't take it. I've had diarrhea once when I had it a long time ago. Actually, diarrhea is an unwanted effect, it's a side effect. It's listed in the summary care product characteristics, and we know that that can happen. So that is more like an intolerance and side effect. It's not necessarily an allergy. Also, quite often, patients come in with a penicillin allergy, but then when you dig into what's the nature of the allergy, they're not sure, or they've just been told by their parents, or they've had some kind of side effect when they were really young. So how do you know how to distinguish whether you're actually allergic to penicillin or not? So penicillin allergy is really serious and essentially it shows up really fast. So within minutes to an hour. So what you will get after having even a small dose of penicillin, you will get hives, like a skin reaction, you'll get swelling, you'll get wheezing, difficulty breathing, and even fainting. This is a life-threatening condition, and that is why it's really important, if this happened, not to have it again. However, a lot of people, as I said, are under the impression that they are penicillin allergic, but they might not be. Maybe they had a rash as a kid, maybe they had a bit of upset stomach, or maybe just their parent told them that they're allergic to it. Now, the problem with this, if you mention to one healthcare professional that you're allergic to penicillin, this is likely going to stay in your records forever. So that's why in future, maybe 20, 30 years from then, in some kind of situation where you really need a penicillin class antibiotic for treatment, we won't be able to give this to a patient because of their status of penicillin allergy. However, this then, reduces the treatment options, which is not great for either the doctors or the patient. That is why I think something called penicillin allergy testing is quite useful. And this is something that you can ask your GP or doctor about. So it is safe and it is accurate and it can actually determine whether you are allergic to penicillin or not. And if you're not, it can delabel you from that so that it's no longer in your status and medical records, which is good for future because you can unlock better treatment options in future in case you ever need it. So I wanted to touch base on cross sensitivities as well. So if you're allergic to one drug, you are likely, or not likely, but possibly going to be allergic to this drug that is from the same family. So if you, for example, have an allergy to, let's say, ibuprofen, which belongs to NSAIDs, non-steroidal anti-inflammatory drugs, you might have a reaction to aspirin. This is not always the case, but it can happen. Same, which you might have heard of, is penicillins and cephalosporins. Cephalosporins are another type of antibiotics. They're not the same group as penicillin, but they're kind of same family as penicillin and antibiotics. Previously, we thought that the cross-reactivity, which means that if you're allergic to a penicillin, you'll also be allergic to cephalosporin. This cross-reactivity is believed to be 10%, but this was based on older data and early generation cephalosporins. Now, more recent evidence is actually showing that under 1 to 2% in patients with a true IgE-mediated penicillin allergy are actually going to be allergic to cephalosporins. So what I'm trying to say is that, yes, allergies are really important. And sometimes if you're allergic to one thing, you might be allergic to the same thing of a different drug from the same family, but this doesn't need to necessarily be the case. And it is crucial to know the nature of the allergy before that allergy being documented on someone's records. So I'm going to tell you an interesting thing that is often done in healthcare when it comes to allergies, what is called the provocation testing. So let's say you are allergic to an antibiotic called ciprofloxacin. Ciprofloxacin is a quite powerful quinolone antibiotic. Now, we had a patient who was allergic to ciprofloxacin and was also allergic to penicillin. So there were limited options what we could give, so we trialed out levofloxacin. Levofloxacin is another quinolone antibiotic, and essentially what we did in order to see if the patient is going to have a reaction, because as I mentioned, they're from the two same families, so likely if you react to ciprofloxacin, you might react to levofloxacin. So essentially we did this called provocation testing. Now, provocation testing means that you give a tiny amount of dose, so 1% of the dose, you wait and see the reaction. If no reaction, you give 10% of the dose, you wait and see if there is a reaction, and if there's no reaction, we give the remainder of the dose. Provocation testing is quite useful when you are not, obviously, you shouldn't be trialing it out in patients with anaphylaxis, confirmed anaphylaxis, but if you're not sure of the nature of the allergy, and if you're trialing, if you have no other suitable options, especially when it comes to antibiotics, then the provocation testing can be quite useful. Now, talking about provocation and desensitization, that brings me to my next topic, which is peanut allergies. Peanut allergies are quite common, and as you know, they can be quite severe and they can really affect someone's life in terms of how they feel, and they really need to say that everywhere they go. They need to go on the plane, in a restaurant. And this is why new fronties, desensitization and allergy trials, there has been a lot of research put into trialing to treat the severe peanut allergies. So exciting research on desensitization, which is basically slowly exposing people to the allergen to train the immune system not to overreact to it. This has been established in peanut allergies and is being explored for dust mites, pollen, and even some drug allergies. So it's an area to watch. And if you are interested in some studies, I'll discuss this as well. But essentially, there was an article just recently in April 2025 in People's Magazine, and its headline was "Man Who Nearly Died from Peanut Allergy Now Eats Them for Breakfast. Here's How He Did It," which I find absolutely fascinating. But essentially, Chris Brooks-Smith is one of the people who successfully took part in the trial and can now eat 4 peanuts a day, where he previously worried that he might have died by accidentally eating part of a peanut. He participated in Goopy trial, a phase 2 trial recruited 21 adults aged 18 to 40 with a clinical diagnosis of peanut allergy and guys at St. Thomas Hospital. So essentially a man who 10 years ago almost died from eating nuts by accident, he's now enrolled into this trial and he can eat nuts freely almost. So a lot of research, as you can imagine, is going into this. And I just looked at some interesting clinical trials and studies that are happening right now. So there is a Natasha clinical trial for children and young adults. And this is a 2.7 million randomized control trial funded by Natasha Allergy Research Foundation, which aims to assess the effectiveness of oral immunotherapy, OIT, using everyday foods to desensitize children and young adults to peanut and cow's milk allergies. So key details of this study is that children aged 2 to 23 with peanut or cow's milk allergies, they are basically given daily small, gradual, increasing amounts of allergenic food under medical supervision. Duration is 12 months of treatment, followed by 2 years of monitoring for long-term safety and cost effectiveness. It is available at different 9 NHS hospitals across UK. And the current status is that it fully recruited participants aged at 6 to 23 with peanut allergies, and it's still recruiting children aged 2 to 3 with peanut allergies. Results are expected by 2027. This is absolutely amazing, and there have been some notable outcomes. So some participants have shown significant improvement. For instance, an 11-year-old boy who couldn't tolerate even half a peanut before the trial can now consume 6 peanuts daily. It's crazy. There is a Goopy trial, which I mentioned. So grown-up peanut immunotherapy trial for adults. And this is for adults age 18 to 40 with severe peanut allergy. So gradual introduction of peanut protein starting from 0.3 milligrams and increasing to 300 milligram over 9 months. Outcomes are that approximately 67 of participants could tolerate up to 5 peanuts daily by the end of the trial. Now, this study marks a significant advancement in treating adult peanut allergies, demonstrating that OIT can be effective beyond pediatric populations. It's absolutely great. There is another study called Palforzia treatment. And this is actually, and Palforzia is an FDA approved oral immunotherapy for children 4 to 17 with peanut allergies. And however, it is quite effective, but it's also quite pricey. Palforzia treatment can be costly, estimated around £10,000 for a product itself, excluding additional hospital visit costs. And finally, there is a peanut allergy vaccine trial, which is a researchers at Imperial College London National Heart and Lung Institute in collaboration with Allergy Therapeutics. They are developing a novel vaccine using a virus-like particle VLP technology to encapsulate the peanut allergen protein RAH2. This is a phase 1 clinical trials and basically the vaccine to treat the allergy, and findings are already there. So the vaccine demonstrated safety and tolerability with no reactivity observed during skin prick tests. So this vaccine has a huge potential because essentially if it becomes, if it's really successful, it could really offer a long-term solution by resetting the immune system to tolerate peanuts without triggering severe allergic reaction. So I find this really fascinating. And also, I don't know if you notice, but whenever I go to a restaurant or a cafe, and if I order anything, even if it's just a drink, all the waiters always now ask when taking the order, do you have any allergies or are you aware of any allergies? I really like this, and I think this is quite good. But it also makes me think that, people are becoming increasingly aware that allergies are quite often, and there's something that's very common, and that's something that's out there, and it's very serious, and we need to be aware of it. But it also makes me think that the number of allergies, just the prevalence of allergies, has increased over the years. So I was looking into why this might have happened, and there are a few theories, so we can't say for sure that it's one reason or another. But the hygiene hypothesis, which I mentioned earlier, and the fact that we are being brought up and growing up in a very clean environment with less exposure to any microbes, that can also lead to immune system then not being as maybe strong and not being as primed and hence overreact to some not so harmful substances such as pollen or food. The changes in diet and environment, so we are eating more processed food, there's more pollution, there's more microplastics, there are additives, and this is all affecting gut health, which is then increasing prevalence of allergies. Vitamin D deficiency, actually being more indoors, lack of vitamin D, a lot of people being vitamin D deficient, lower sun exposure, that can actually affect our immune system regulation. If the immune system is downregulated, then again, we're more prone to allergies. But also an interesting theory, which I found, is about C-section and early use of antibiotics. So this can also affect the gut microbiome early in life, predisposing someone to allergies as well. And then finally, another theory is the climate change, as I said. So the global warming, the temperatures rising, that just means that the period, the season of pollen is longer, which is potentially longer period of us being exposed to an allergen, which can then trigger allergies and hay fever. So yeah, interesting topics. I think I'm very excited for the research happening with peanut allergies. I think we should watch the space. There might be new research for other allergies as well. It is really nice to have a treatment or a vaccine so that you don't have to worry about, having a severe allergic reaction on a plane or in a restaurant. So that's absolutely brilliant. And I think if this is something you're interested in, definitely discuss with your doctor or pharmacist and see what your options are. But yeah, I don't know if you are affected by any allergies or hay fever. Drop me in comments what works for you, what doesn't work for you. And also give me feedback on this episode. I release episodes every Tuesday. And if you want to be informed, get notification, just please press subscribe. Thank you so much for watching. Hope you enjoy and see you next Tuesday. Bye.